We are the Pennsylvania Manufacturers Association.
We are the Pennsylvania Manufacturers Association.
Business in Pennsylvania.
And business in Pennsylvania is our business.
Let's kick off the Medicaid discussion with an email from Robert in Sunbury, who asks, why do you refuse to expand Medicaid, which will enable thousands of Pennsylvanians access to affordable health care? Time to put aside politics and do what's right for people needing health care. You have an alternative plan to utilize that money, and a series of public hearings that were held on this issue recently wrapped up. We've talked about your plan many times on this show, using money to allow low-income Pennsylvanians to buy insurance themselves on the exchanges. Are you any closer to getting the feds on board with that?
Oh, we are having discussions on a regular basis. I spoke with Secretary Sebelius on Friday at about 5 o'clock in the afternoon. Lengthy discussion about the Children's Health Insurance program. Mm-hmm. We're not necessarily seeing eye to eye on some issues, but there is movement towards the middle by both sides on that issue. But there's also thorough discussions with CMS, which is part of HHS, on the what people would call the expansion issue. Part of what we had to do is we put our program out there. We had to have these hearings. We are in discussions with CMS. We are tweak the program. It has not, contrary to reports in the paper and emails that you've received, we have not submitted it formally to HHS at this point, but that will probably be going down sometime in the middle of next month, with the idea that if we've worked with them ahead of time to get what can we agree upon, that we can get a faster turnaround on it.
What about Robert's claim that it's politics? Is this a political thing for you because you don't like the Affordable Care Act, or is this you trying to do what's right?
This is what's doing
you believe.
What's right. This is what is doing what's right. There are many people that seem to believe that this money just appears. There is a huge cost to taxpayers of the United States and taxpayers of Pennsylvania. And when I ran for governor, I promised we were going to reform the way we do things in Harrisburg. We're going to protect the taxpayers' interests, and that's exactly what this is looking at. Right now, Pennsylvania has 1 in 6 people on Medicaid. If we were just to take the money from the federal government, as some states have done, we'd go to 1 in 4 people on Medicaid, which, as you know, is an entitlement program, and we would have to continue to fund that. And I will go back to what I said last year. The promise from the federal government is that they will fund it at 100% for 3 years and 90% thereafter. Yet at the same time, this last year, we received notice that they're going to reduce our funding to Medicaid by $310 million. Now, would you trust them? That's number one question. Special education is an example of where the government had promised that they would fund it at a certain level years ago, close to 50%. It's now funded at 17 to 18%, and it's one of the biggest cost drivers in a education budget in any school district. Again, would you believe them? I don't. So what we're trying to do is create a program that has the individuals in this category go out, receive money, and go out and purchase it. There's a couple reasons for that. One, I don't want to have to create a bureaucracy of about 2,500 people. It's going to be big enough as it is that we're going to have to add workers at the Department of Welfare to the tune of about 700 additional workers if we get what we want. 2,500, that's 2,500 pensions, salaries, and health care benefits. That no benefits going to the individuals who need it. Mm-hmm. Private sector is already geared up and ready to do this. But we want them to become involved in their own health care, not just say, okay, I have this, I'm covered, I'm not interested in my health care. So we're actually looking for a healthier lifestyle for people. And, the White House is looking for healthier lifestyles. And when you are spending your own money, when we've asked for a premium of between $5 and $25, you're going to start thinking about how you're taking care of yourself. You're not necessarily going to go to an emergency room for what could be a doctor's visit. So that is going to have a big role in this. And we know that other states have already been permitted to do some of the things that we're doing. It is better for the individuals who will be the recipients, and it's better for the taxpayers. It's a policy standpoint. It is not politics.